Welcome, everyone, and thank you for joining. If you're watching this live or catching the recording later on, or maybe a walk in the car, welcome to you as well. Today, we're tackling one of the most underestimated problems in healthcare, and that is the problem of incoming referrals. Whether you're a cardiology practice or a specialty practice, that could be gastroenterology, dermatology, behavioral health, if you're even in an FQHC, even like a medical equipment manufacturer, you have this problem of a lot of faxes coming in, and a lot of them are referrals still coming in via PDF, scan document, or of course, we discussed fax or e-fax. So today, what's happening is that a lot of intake teams are manually triaging a lot of messy data, and you got to find missing information, and then you got to push referrals into your EHR across systems like eClinicalWorks and NextGen and NetSmart and Keepu and Athena. And today we'll talk a lot about Salesforce and Cerebrum. But we got to be careful with things like slow patient access, delays, or even staff burnout, because it takes a lot of manpower and help to be able to do this, and it affects revenue. And most importantly, it affects the patient. So, without further ado, let's dive a little bit deeper and unpack how referral intake works when you layer in automation, which Roger Hahn here of KMH Cardiology will be getting into. But let's start with some intros. So, Ronald, let's start with you. So, I know, Ronald, you are the Associate Director of Healthcare Automation. You work very closely with a lot of our specialty clinics, and you work pretty closely with Roger, actually. So, tell us a little more about yourself and your background.
Yeah, absolutely. Good afternoon to both of you, Gabe and Roger. Good afternoon, everyone on the audience side. My name is Rano Banerjee. I'm with OpenBots for the last 4 years, and currently I'm the Associate Director of Healthcare Automation Solutions at OpenBots. Uh, a little bit about OpenBots to start with. So, OpenBots is a agentic AI platform for healthcare revenue cycle, which means our goal is to make sure that we are increasing the revenue, reducing the cost, and improving the financial performance for healthcare providers. Now, in terms of technology, we have been focusing on AI and automation, but another unique thing that we have focused on right from day one is processing large data sets and particularly unstructured data in the world of healthcare, which is pretty big. Once again, excited to have Roger Hahn on the panel today. For the viewers, KMH Cardiology Centers is one of our very old customers. In fact, they embraced AI. I think it dates back before the days of GPT even came up with, even before AI and automation became a buzzword, to say the least. So there's a lot to discuss, a lot to unpack, and a lot to learn from Roger today. So, yeah, absolutely. Gabe and Roger,
Yeah.
I'm very much looking forward to this session.
Excited to have you as well. So obviously, I'm also joined here by Roger Hahn, Chief Transformation Officer at KMH Cardiology. So Roger, if you don't mind, give a little bit of a background of who you are and what you're doing here.
Yeah, for sure. Hi, everyone. So my name is Roger Hahn. I'm the Chief Transformation Officer at KMH. I've been with the company for a little over 7 years now. So we primarily serve the public healthcare sector in Ontario, Canada. Our primary services are cardiology, nuclear medicine. We also operate MRIs, PET-CTs, and we manage a bunch of specialists as well, primarily cardiologists and internal medicine specialists. And prior to KMH, I was with a private healthcare company. So, including KMH and my prior experience, I've been in the healthcare industry for over 10 years now. And in my current role, I am focused on technology implementation and, my title, really transformation, just around how can we streamline things for our various facilities and to make sure that patients get access to care as quickly as possible.
Absolutely, Roger. So let's get into it. So Roger, we talked to so many teams who already have a massive referral and intake process, and they're buried, and they're now finally warming up and looking at AI to cut down a lot of the manual back and forth. You've been doing it for a little while, so you have a thing or two to educate folks. I mean, the real question that everyone keeps asking is, can AI actually plug into what we're already doing? Or do we have to rebuild our whole referral workflow from scratch? How does that work?
Yeah, I think it's important to, look at your processes and see kind of what aspect of it makes sense to um, inject AI or automation into it. I think, in our case, especially in healthcare, there's lots of faxes. And unfortunately, that's still the main method of communication when it comes to, how referring providers want to engage with us. And so a lot of human powers put towards that to triage faxes and handle processing those requisitions. So I think when it comes to using AI and breaking down your processes, you really just gotta make sure you're narrowing on the use cases that make the most sense, where you can measure success and start small and then expand um, from there.
No, absolutely. In your world, Roger, I mean, what made referral automation a priority? I mean, it's interesting to know that when it comes to Canada and the United States, one challenge that both healthcare systems face is in the front end. The back end is very different, but the front end, there's a lot of similarities in the way the intake process goes. But I mean, what made referral specifically a priority for you all?
Yeah, I mean, it's back to the whole facts topic, because in a given month we get anywhere from 70 to 80,000 pages of facts, and it could be for a variety of things. It's requisitions, it could be prior medical records, it could be prescription refills, and it required a lot of people to be involved with managing those faxes so that we can book the appointments, get back to the referring offices, and as you can imagine, there's lots of steps in between. But and when it comes to processing faxes, it requires someone to look at the fax and then decide what to do with it. And that's why we wanted to focus on automating the faxes first, because in our organization, and I'm sure in a lot of other healthcare organizations, a lot of our work starts when the piece of fax comes in. And so if we're able to automate it, understand what those requests are, and then get it to people sooner versus having to wait for a whole team to triage through the thousands of faxes every day, then we can get the patients into our clinics much sooner and get back to our referring providers as well.
Makes a lot of sense. Roger, on this particular note, I wanted to ask you a question which we often hear from our prospects when it comes to the change in process if you're looking at implementing AI. So, we get this question a lot, like we already have a big referral and intake team, and we right now want to use AI to reduce the amount of work our team members are doing within the EMR systems, because that is taking away their focus from patient experience. So, can AI simply slot in into the existing processes, or it can layer on top of our EMR and the other systems we use? Or do we need to use AI in a way that we entirely need to rebuild the workflow from scratch? What would your advice be to these leaders when they have these questions going on at the back of their head?
Yeah, I mean, every organization's different. I mean, in terms of how I would approach like some of our existing processes, and when it comes to how technology would, change it, I think it starts first with augmenting people's roles with AI. It's really helping them become more efficient for some of their complex tasks, and then for the more repetitive and tedious tasks where it's more rule based. I think those are where I would, lean on automations and AI to kind of take off their plate more. But just generally speaking, you cannot implement technology and AI without changing processes. And I would say it's always best to kind of look at things, like take a step back to see
Hmm.
how your processes can change with the technology that you're planning to implement, because AI is just growing so fast these days, and every month or every day that goes by, it's getting better and better. And if you're only set on just keeping your processes the way they are, it's not going to do you. Um, I think it's not going to give you the value that you want.
Yeah, no, I think that makes a lot of sense. And I think, Roger, we often hear about this topic, which is redesigning the process first and then coming up with an AI or automation solution, instead of simply automating the process with AI on top of what is already there. Because I think The problem with automation and AI is that if you automate a bad process, it's going to remain bad or it's going to go worse. So you have to first redesign the process. That's kind of what you are alluding to, if I'm getting it right. Um, One question that I had was like, Roger, you have been using automation and AI for a very long time, in a sense that KMH Cardiology Centers have automated the referral process even before the word AI and automation became a buzzword. So, what made you choose referral process as the first automation candidate maybe 3.5, 4 years back? Why did you? I mean, we know that you are a specialty group and you are receiving large volumes of referrals from the other providers. But why did you choose the referrals in the first place, Roger?
Yeah, I mean, our customers are patients and referring providers, and when it comes to keeping them happy, it's processing their referrals as quickly as possible, and that's why, we focus on that first. And capacity utilization is extremely important across all our facilities as well. We have lots of technologists, nurses, doctors that are working every day of the week at each of our facilities, and when we have referrals that are sitting around that haven't been processed by our staff and patients aren't being booked in, it's unused capacity. And so there's a lot of waste that goes into that from a cost perspective. And that's why, automating referrals and again, getting patients into our clinics as quickly as possible is the most important thing here.
That's awesome. That flows very well into metrics, which every client cares about, especially every healthcare provider cares about. Like, okay, if I automate this, then what happens? What benefits do I get? So an interesting stat is that today, 88% of referrals are still manually processed. So you're in the 12%. I mean, obviously, there's still people doing things, of course. But I mean, in your world, I mean, what metrics matter most to you for this? Because you mentioned a few of the stakeholders that are involved, the patients, providers. But what metrics did you look at before? Are you looking at now? And how do you monitor this?
Yeah, I mean, maybe I'll start with like some of our operational metrics. So we have data on how many faxes we're getting and how long it takes for those faxes to turn into appointments and then, reports and so forth. And so we've been, measuring turnaround times from when we receive a rec to when they first get booked. And there can be lag times and sometimes they're patient driven, but for the most part, that was our way of measuring, like, are we processing referrals as quickly as we can? And when there's a big backlog of faxes, it affects those metrics because people, can't find the referrals, or if they want to, they have to dig through a lot of other types of documents before they can get to the actual requisition. So measuring, just a turnaround time on orders or faxes and when those get processed into appointments, that was one metric. And then in terms of just, I guess, referral automation and intelligent document processing, as an example, like we have to measure, how many requisitions were successfully processed, how many errors were generated. And of course, there's always edge cases and handwritten documents that can make it a little bit challenging at the beginning. And, to your point about how we kind of got into it a couple of years ago, the technology was still OCR based, couldn't really handle handwritten as well, but now it's gotten much, much better. And with AI and just the options that are available to us now on the intelligent document processing side, even, just variations on your requisition forms, like those can be handled pretty easily. And so that's made it a lot easier for us to, manage all the different versions of our requisitions that's kind of floating out there in the healthcare system. And I've seen our kind of success rates of processing that, continue to improve. And now we're hovering in the, high 80s and low 90s, depending on the day. But I'm pretty happy with where we are.
That's phenomenal, Roger. It actually, I mean, I was about to ask you this question, but I think you answered almost half of it, which is how do you handle messy data? But one thing that I can pick up from what you said is, at least in 2025, the amount of new requisition forms which AI can recognize and handle is getting better compared to what it was in 2024. But the other notion that we always try to convey to our prospects is AI is great and you can automate a lot of things, but you really need to have the augmented intelligence of people plus AI or people plus automation. You simply cannot just take AI as the source of truth, because there are
Mhm.
chances when an AI can fumble and falter. So if I had to ask you this, you went by the 80/20 principle. How important is that human in the loop component? If you can emphasize a little bit on that, because AI can handle things, but then there are things which AI is seeing for the first time where it is a little bit shaky, to say the least. So if you can address how important is that augmented intelligence and human in the loop component.
Yeah, I mean, it's extremely important. So to give you an example, like you can only, test and check so many things. You can feed, you can try to train a model as much as you can during like the development or kind of like testing phase, but there's always going to be edge cases that you cannot anticipate. So just making sure that your end users who are, on the other end of that automation or process is involved to check before they process the referral
Hmm.
further, and to also provide feedback to us on the technology implementation side. That's extremely important. I think engaging your stakeholders early on about what we're trying to work through, and then managing their expectations and just making sure that they're part of the overall design of the new solution or the new process that they're going to have to adopt. I think is extremely important, and then just making sure that they stay engaged after you go live as well, because their feedback is critical for you to continue to improve the platform or solution that you're working on. And a lot of times you have to, be more proactive with getting that feedback, because they're worried about their day to day. They're just trying to, deal with patient facing stuff. And you really have to get in front of them to encourage them to share feedback so we can keep making the solution better for them.
Yeah, no, absolutely. I mean, you clearly answered the question in terms of the importance of human in the loop. Um, Roger, I heard you saying that you already have got the metrics in terms of the referrals that are processed, the referrals that are missed. Now, one of the main intentions for an AI vendor is to reduce the overhead cost as much as possible, because that's the most easiest metric that we can measure. But in terms of improving the financial performance of healthcare providers, you also have to see how AI can be utilized to increase revenue for a healthcare group, or how
Mhm.
AI can be utilized to reduce the amount of denials that happens from the payer side of the house. So if I had to ask you this, like, what really happens if you are missing a referral? Like, somehow the AI and the augmented intelligence of humans were not able to triage and process the referral. What happens then? Like like the impact of it.
Yeah, so I mean, for us in Canada, the revenue cycle management and the payer side of things doesn't really apply, because in Ontario, healthcare is publicly funded by the government. So
Right.
we get reimbursed for every service that we provide. But I mean, when it comes to missing a referral, not processing it properly, it's hurting the brand. It's affecting the patient. And we have a team of physician relation managers that are out there in our communities day in and day out, nurturing these relationships, and so making sure that we have we process every referral that comes through is extremely important, and making sure that their patients are taken care of, and that we get a report back to them so that they can continue their care. And I also just want to touch on, like, I think earlier when you were like asking me about like changing processes and kind of like having AI as part of like people's roles, or augmenting their roles with AI. I just want to touch on how when you look at these processes that you're trying to improve, you know the technology is not gonna fix it all. There's a lot of stuff that we had to work on with our internal teams to just change um, what they had to do. So, for example, on our requisition form, when we first started doing intelligent document processing, we had to standardize our forms, make the fields more easily readable for our purposes, and then we had to do a lot of external marketing with their referring providers to encourage them to use more digital forms, more fillable forms, and use less handwritten forms, and really try to change the behavior in the community as well, so that when the referrals do come through to us, we can process them faster. Because if you're sending us a handwritten rec, there's a likelihood we can't process it automatically, and that can delay when you'll hear back from us and delay when your patients get booked in. So we were trying to use that angle to encourage, our external providers to send us a digitally filled rec, and that way our automations can pick it up and we can expedite that process for you and your patient.
That's an excellent insight on the change of process, Roger. Really appreciate that. I mean, that being said, obviously in 2025 we have seen the large language models getting way more advanced than people anticipated it to be. So yeah, we are feeling very positive as we step towards 2026 in a way that more and more handwritten data can be classified and read through by AI engine. But the point that you made is absolutely an excellent point, that you perhaps had those handwritten requisitions to be dealt with separately versus the digital forms, which could be simply read through by an intelligent document processing engine. So yeah, I appreciate that point, Roger.
Yeah, and I mean, even something else that we did was like we built a whole online appointment request form on the OpenBots platform, and that's what we've been encouraging patients and providers to use as well. And if they're using that form, then again, that helps automate a lot of their automate the processing of the referral versus sending us a traditional fax.
Yeah. Roger, could you tell me a little bit about the patient's behavior in a sense that, I mean, you're the chief transformation officer, you know this at the back of your hand. Like, I think the most preferred way for patients to take an appointment or take a scheduling exercise is going to be by calling someone or visiting a clinic. But how do you see patients picking up this digital exercise of going to the websites and filling out online forms and making sure they're more prepared before even they step into a clinic?
Yeah, I mean, we have the so in terms of like patients going onto the forum, that's still a very small percentage because we're a specialty clinic, and so a lot of times patients go where their specialists tell them to go or their family doctor tell them to go. So we're a lot of times getting referrals directly from those referring offices, but there are plenty of patients that email us the requisitions for an MRI because there's usually quite a backlog and there's a lot of wait time across Ontario, like a long wait time across Ontario. So we're seeing more and more patients email us their requisitions, and they're, getting more used to checking different facilities to see which ones have a shorter wait time. And so in those cases where patients are, aware that they can take their requisitions elsewhere and will come to us directly, then we are, trying to direct them to those digital channels versus calling in, because we get close to 20,000 calls a month at KMH. And right now we're trying to push patients and providers to engage with us in different channels, whether it's SMS or email or through our website. I think there's a lot that can be done to streamline that engagement with them if we can get it right, and we're working through a few different kind of solutions right now.
That's awesome. And so that's really helpful insight. And Roger, you told us in the past, this has probably changed, but there's been over like 50, 60,000 faxes you receive per month, over 50 folks that are on the team even processing those. I mean, I'm curious, what do they say? Like, what does your staff say about the impact that automation has had?
Yeah, so I think at the beginning, there was definitely a lot of hesitation and, is this going to help? It's going to create more work for us. And so we really had to, take them on the ride to make sure that they understand kind of why we're bringing this in, how it's being designed, and how it's supposed to help them. And over time, I think now they see it a lot more positively. I think at the beginning there was a lot of hesitation, and you're disrupting their workflow. You're changing the ways you're changing how things are being done. You're reorganizing how the teams are supposed to manage this process. So naturally, there's always a bit of resistance, but I think now it's very much ingrained into how they do things, and we also supplement kind of the solution with a lot of reporting through our business intelligence platform, and that has definitely made their lives a lot easier in terms of kind of just managing these referrals that have been automated, as well as the visibility that was kind of lacking within the EMR.
That's excellent. And it makes you think about, I feel like the two top jokes made about healthcare is around physician handwriting, which we deal some of that with technology, obviously, and fax machines, which we deal with that in this automation. It's kind of funny how there's so much jokes around that because in some ways healthcare is antiquated in that it's one of the only major industries still using a fax machine, and reading physician handwriting is tough. But another question that we get, because you've actually trained a lot of our clients, and that usually when they're looking at the OpenBots platform, when they're in the early stages, they want to talk to someone who's been there for a long time, and then you've spoken to them and kind of given them guidance. And one of the things they want to know the good, the bad, and the ugly. They want to know what was the hardest part. So I am curious, in terms of timeline of how long things take. That's an important part because it's an iterative thing. Is basically the feedback I've gotten from you and other clients that it's not just like, okay, you implement this and it's gone. You have to keep iterating, make it better and better and better and better. So, I mean, for the CFOs, the chief revenue officers, the CIOs who are also in this seat, because they want to make the right decision. They want to make sure they're taking the right set of risk, and they want to know what the reality is when they bring on automation, because it's not squeaky clean, even though it's impactful. I mean, tell us a little more and walk us through that. Like, how long does it take? What was the process like?
Yeah, I mean, I think we started working with OpenBots and our implementation partner now like over 3 years ago. So don't remember all the details, but I think I could safely say that, you know, from I guess starting the project to when we like implement it into production, it was probably around 2 to 3 months, maybe 4 max. And you know, a lot of that had to do with just setting up the infrastructure and then, you know, getting the team to understand our business as well. But you know, they already had a lot of healthcare experience as well, so that definitely made it easier. And then it was more so just time for us to look internally to understand like what are the variations of requisitions that's out there with our providers, how can we try to standardize those things to make this solution work the way we need it to, and then also just to get, you know, getting a sense of like what's handwritten, what's not. And so a lot of those kind of internal kind of reviews took a little bit longer before we went live. But yeah, to your point, you know, nothing, you know, it's not going to come out the gate 100% automated and perfect. There was a lot of learnings, and I think just working with a team that's iterative, that understands healthcare, I think that's what's key. And then you also have to improve your own kind of processes internally and try to change the way referring providers are engaging with you to make sure that you can get the most out of these solutions that you're putting in place.
Fantastic. Roger, I wanted to ask you a very open question on your thought about interoperability, and I'll set up the context for this, Roger. So even in 2025, as we are almost going towards 2026 now, people feel that automation vendors and AI vendors are going to do a very good job of going through payer portals, going through referral faxes, reading the data from there. But when it comes to reading the data back to the EMR, AI and automation vendors will have a challenge. And there is a notion that has been built, I think perhaps, that without APIs, you cannot read the data back. That being said, I think you're very much privy to the fact that surface automation and user interface automation, where a bot can log into an EMR like Cerebrum in your case with a username and password and do all the things that you want the bot to do. So my question to you is, how important is AI when it comes to interoperability? And do you see that AI and automation is closing that loop of not just reading the data or extracting the data from different portals or systems or documents, but also feeding that same information back into the system? So if you can emphasize a little bit on that.
Yeah, I think you know, a couple years ago when we started using robotic process automation, you know, that was the only way to write back into our EMR in the absence of APIs. And I think, you know, fast forward to today, with where agentic process automation is and what people are able to do now with computer vision and just kind of improve. I don't know what the exact term is, but the enhanced RPA or the 2025 version of RPA, it's definitely you know, much more easy to write back into the EMR. And the reality is, so many of these systems out there, whether it's EMR or payer portals or these other government repositories. Like they're just not going to have open APIs or external facing APIs for you to integrate with. And even when they have APIs available, it's not necessarily going to be the ones that you need to automate the workflows that you're hoping to automate. So I think really leaning in on the agentic process automation and those types of solutions is going to be really important. Not having APIs is, I think, still very much a problem that's not going to go away when there's a lot of gatekeepers out there.
Thanks so much for that. I mean, I just wanted to make a comment for our viewers that, um, as Roger said, like there are many portals where, and those are like mostly government portals where it's not easy or even accessible for AI vendors to penetrate the portal because they won't allow bots so easily. What we do in that particular situation is that we either have to get the data out of the portal manually, or in the absence of APIs, we have to use a technique which is very prevalent in the automation world. We call it surface automation or user interface automation, meaning the bots can access the portal with a username and password, and it can go into the downstream process within the portals and perform any action that you want it to perform, as long as there is a set of pattern or rule-based logic that you can apply to it. So thanks, Roger, for kind of giving us an overview on the API piece as well as the user interface automation piece. Appreciate that. Gabe, I know you have a question that you wanted to ask Roger, so yeah, time for you to ask.
No, I think this was extremely insightful, extremely informative. I mean, just to kind of close things out, guys, there's two more for you. I mean, a lot of clients, they want to start small. Like a lot of like providers say, okay, this is awesome. I want to accomplish XYZ, but how can we start small? I mean, what advice would you give, Roger, to a healthcare provider that is exploring AI across any piece of it, or even referral? But what advice do you give and say, hey, make sure you do XYZ? Like what's the best piece of advice you can give them to help them along the journey?
Yeah, I mean, again, every company is different. So, but just using kind of my experience as an example at the cardiology company that I'm at, I think it's looking at which problems are the most high volume, that's taking up the most of your people's time. That's probably a good place to start in terms of thinking through which kind of use cases to go with. If you're kind of bogged down by like thousands and thousands of like prescription refills and prior authorizations or that kind of stuff. So maybe that's a natural place to start if requisitions isn't the main thing. For us, it was requisitions because we needed to fill our clinics and get our patients into the clinic and get back to our referring provider. So naturally we kind of went there. But yeah, I think just looking at what are the major bottlenecks in your organization, and then seeing which ones are not as risky to automate would be a good place to start. And even in our case right now, as we're thinking about AI and kind of where else we can implement that at KMH, we're still very much focused on like the tier one stuff where it's low risk, nothing to do with like clinical decisions or that type of stuff. It's really just like dealing with like inquiries and FAQs and directions and prep instructions and appointment confirmations. Those are kind of what I call like the tier one stuff that we're trying to automate more and more with AI. And then once you have a good handle on that, you have a good way of just governing the data and how these AI processes intertwine with your other human-driven processes or just any other kind of communication processes that you might have with your patients and providers. Then yeah, kind of grow from there, but start with the less risky kind of use cases and what's high volume and the big bottlenecks.
That's fantastic. Kind of like an answer that I was also planning to give, Roger. Like when we hear this question from our prospects, like, hey, we have seen AI has been transformative and it's giving us, not us, but a lot of providers a lot of impact. So what could be a good starting point? And we often allude to the point that you should always identify a process where a lot of labor is devoted to that process today. The process should be more like a rule-based process instead of a reasoning-based process. For example, referral process automation or cash posting or insurance eligibility checks. These processes are almost like you do this day in, day out, but the mechanism is pretty similar. You would go into a payer portal, you would put the patient's member ID and date of birth to run the insurance eligibility check. Or for referral process automation, you go into the requisition form and you're looking at almost the similar data fields that you would like to extract, which is patient's name, date of birth, demographic, referring physician information, so on and so forth. So here's what we often guide our prospects: that identify an area which is pretty much rule-based, routine task that your team is doing every single day. But at the end of the day, you are devoting a team of 5 dedicated resources for that. So I kind of align my answer based on what you said. Uh, I have one last question for you, Roger. It's not exactly a question, but it's also like out of curiosity. I want to know about this. How has this referral automation scaled across KMH in the different service lines? Has it scaled across from cardiology to specific MRI and other departments, or is it like a horizontal approach that you have taken over the years?
Yeah, over the years, we've scaled across all our product lines except for PET CT, just because that's a very complicated process that has just so many steps involved, and we have a tight knit team that kind of manages that. So automating that wasn't really high priority, and it's also low volume. But beyond that, we've gone from cardiology testing to MRI to specialist consults, and pretty much covers all the different services that we offer at KMH on a requisition, minus PET CT.
That's awesome. That's very encouraging to hear, because a lot of providers are saying, okay, let me start with this specific division. Or let's say if you are an FQHC, or if you are a traditional hospital, you have so many different service lines. Obviously, you all focus on cardiology and labs and MRIs. You guys have several as well, but it is very possible and much easier to scale once you've had 1 or 2 wins here. And to your point earlier, like, you don't always have to automate something as complex as like clinical decision making. Like, no matter how phenomenal agentic AI or automation or AI gets, there's still so much rudimentary work left. There's still so much rules-based work left. So you have to still automate that and focus on that before you get into anything more complex. And you may never get to that. At that point, there still might be just people who's better suited to do that for a while. And that's okay. You can still have a huge impact. And you also mentioned prior authorization. I mean, it's so closely related to the referral process, at least in the United States, and depending on what kind of sub-segment of healthcare you're in. But a lot of times, referral coordinators can be also responsible for prior authorization. A lot of times, intake teams are also responsible for eligibility. A lot of times, these workflows blend. So when you're a person managing a lot of distinct workflows, that's where automation really helps you, because now you can do a lot more, and all that rudimentary piece, the rudimentary pieces of all those workflows can be autoplayed and focus on the things that do impact directly either revenue or patient care, which is the reason we're all standing here right now. That's about it. I mean, Roger, any closing thoughts you had, Roger? I mean, this is a phenomenal, it's super insightful webinar for anyone exploring automation, especially within the healthcare provider space, which is booming right now. But any final thoughts you had, Roger?
I would just say, lean into it. I mean, you got to put yourself out there to stay on top of kind of how AI is kind of changing and developing. And, these days with like voice AI and, just all these different agentic solutions that are being talked about, you have to just, keep your ears open and your eyes open, because if you're not, then you're definitely going to fall behind. So, and a lot of times those rule-based repetitive things that you can easily automate may not sound the sexiest when you're hearing about all the cool voice AI and end-to-end automations out there. But I would say, start small, and those things will add value to your organization. And then from there, you could branch out to more complex solutions. And especially when technology is just maturing and getting better and better, when you're ready, it might be able to do all those complex things. But at first, get your feet wet, I think is what's most important.
Love it. So basically, the more boring and unexciting it is, the more automatable it is.
A lot of times, that's the unfortunate truth.
Awesome, Roger. Well, pleasure speaking to you. Thank you very much for your time. Thank you all. If you have additional questions, feel free to put it in the comments, and we'll circulate this recording.